Hey, it's Dr. Yost. I was in the operating room today and I was reminded of a couple of research articles that I wanted to share. Of course, in the operating room, we're always concerned about patients' pain control. And what we're basically looking at in these two research articles is how do we best manage pain control? So this is a major area of concern with the health system and with all of the surgeons out there. We really want to keep people safe. So despite attempts to try and reduce narcotics over the last few years, we still have seen upwards of 16,000 overdoses of patients after prescription prescriptions. So the first study that I wanted to share was this idea of using steroids after surgery. And the recent studies showed that after surgery, there were two groups of patients. They basically were undergoing, tonsillectomy style procedures. One group got just morphine, and the other group got morphine and a steroid. And the steroid group used about half the amount of the morphine, and it actually showed that the patients who didn't get steroids, they actually used about 1.6 times more of the narcotic. So it really suggests that if you don't do steroids, their patients are going to rely a lot more heavily on the narcotic. And despite all of this, it actually, pain control and pain scores and even procedure complication rates were the same. So you can use potentially a safer medication, Motrin and Tylenol, and avoid so much narcotics. The second study I wanted to show you is actually about pain control after two different ENT procedures in the neck called a thyroidectomy and a parathyroidectomy. It's to take out some endocrine glands in the neck. So this one actually showed that non-narcotic pain control was equivalent to narcotic pain control after these particular surgeries. So the study suggests that, again, things like Tylenol and Motrin should be the first line after surgery instead of going to something like a narcotic, and it may even help us to eliminate unnecessary prescriptions. So the reason I wanted to share this with you was this idea that maybe more research will come out, more research in different specialties, that maybe as you go and have procedures done by different providers, you may actually not even be offered opioid or narcotic prescriptions, and that Motrin and Tylenol are first line. So hopefully we can keep people safer with that. Thanks.